This video demonstrates selected meniscal pathologies in knee ultrasound. We focus on typical appearances of medial and lateral meniscal injuries. All cases were correlated with MRI and, when available, confirmed during arthroscopy. The first image demonstrates meniscal extrusion associated with advanced degeneration. The meniscus is displaced beyond the joint space and shows marked deformation. Instead of the typical triangular configuration, it appears closer to an irregular rhomboid shape due to loss of the free edge. Features suggest meniscotibial ligament insufficiency, as these ligaments are no longer aligned with the external contour of the meniscus. The extruded meniscus clearly tensions and deforms the superficial layer of the medial collateral ligament. This represents one of the direct causes of medial joint line pain. This image demonstrates an inferiorly displaced meniscal flap. The fragment is interposed between the joint capsule and the tibial plateau. Such lesions are typically associated with significant pain due to mechanical irritation of capsuloligamentous structures. An intrasubstance delamination is visible in the middle third of the meniscus. Degenerative changes and meniscal extrusion are also present. A detached inferior fragment can be seen beneath the lower surface of the meniscus. This image shows an oblique meniscal delamination with degenerative changes in the pericapsular zone. Degeneration is most pronounced at the level of the inferior fragment. A large meniscal flap is displaced inferiorly beneath an otherwise intact portion of the meniscus. This configuration may result in persistent mechanical symptoms. This image represents a bucket handle tear. Only the residual peripheral portion adjacent to the capsule remains visible. The displaced fragment has migrated into the joint cavity and is not visualized in this scan. The posterior horn of the medial meniscus is shown after surgical repair. Meniscal fixation elements are visible. One component is located in the pericapsular external portion of the meniscus. Another is seen at the level of the semimembranosus tendon. A horizontal intrasubstance delamination is present in the posterior third of the medial meniscus. This image demonstrates a tear originating from the inferior surface of the posterior horn. The tear communicates with a small horizontal intrasubstance delamination. A complex multidirectional intrasubstance tear is visible in the posterior portion of the meniscus. A superficial fissure is also present on the superior surface. The inferior portion of the pericapsular third of the meniscus is displaced toward the capsular attachment. It extends posteriorly and becomes interposed between the tibial plateau and the joint capsule. This configuration indirectly involves the semimembranosus tendon. This image demonstrates horizontal meniscal delamination associated with a parameniscal cyst. The same case is shown again. The parameniscal cyst is now visualized in the transverse plane. Here, the cyst is visualized in the longitudinal plane. It demonstrates features of a multiloculated ganglion. The following images present the same meniscus examined sequentially from the level of the medial collateral ligament toward the posterior horn. This series illustrates how meniscal pathology may vary in extent and morphology along its length. At the anterior portion of the medial collateral ligament, a small horizontal delamination is visible within the meniscal body. The meniscal body remains relatively well stabilized by preserved components of the deep medial collateral ligament, including the meniscofemoral and meniscotibial ligaments. Separation between the deep and superficial layers of the medial collateral ligament is observed. A large everted meniscal flap is interposed between these layers. An additional small fragment is visible within the medial recess between the medial femoral condyle and the joint capsule. At the junction between the middle and posterior thirds, a defect is visible within the upper half of the meniscal thickness. This corresponds to the site from which the flap detached and displaced anteriorly. Within the peripheral capsular zone, a small hypoechoic cystic structure is present. From the inferior aspect, immediately adjacent to the capsule, a superficial fissure can also be identified. Moving further posteriorly, the small cystic structure remains visible. The tear within the inferior peripheral portion becomes more pronounced. The defect along the surface, oriented toward the medial femoral condyle, becomes less distinct. The appearance now resembles fraying of the superior surface and the free edge. The previously well-defined defect as the site of flap detachment is no longer clearly demarcated. Near the posterior horn, the fissure originating from the inferior surface becomes deeper. The cystic structure appears to separate from the capsule and communicates with the intrameniscal delamination. This delamination evolves into a second cleavage plane. It connects with the inferior meniscal surface within the middle third of the meniscal width. All cases presented were correlated with MRI findings and/or confirmed during arthroscopic surgery. This image demonstrates a discoid lateral meniscus. The pathology was not initially recognized during ultrasound examination. The preoperative ultrasound images were retrospectively reanalyzed after discoid morphology had been identified on MRI and confirmed during arthroscopy. A sharp free edge is not clearly visible. A trapezoidal configuration may be suspected, yet the exact peripheral extent relative to the capsule remains difficult to determine. High-gain settings were used during this examination. The external portion of the meniscus appears markedly hyperechoic, reflecting its dense fibrous structure. Most ultrasound waves are reflected in the superficial layers, which limits visualization of deeper portions. The aim of this presentation is not to assess the sensitivity or specificity of ultrasound in evaluating meniscal pathology. It is not intended to initiate a comparative discussion between imaging modalities. The purpose of this video is to demonstrate selected meniscal pathologies as they may appear in ultrasound.